Hello, I'm Peter Allcroft. I'm a palliative care doctor down at Flinders Medical Centre and I work in Southern Adelaide Palliative Services.
Hello, I'm Kathryn, Hourigan, a consumer advocate. Together, Peter and I co-lead the Statewide Palliative Care Clinical Network of the CEIH. So Peter, we're here to talk about what happens when people are dying. So my question to you is, what are the things that people most fear about dying?
Thanks, Kathryn. Often at that point in someone's illness, it's not the death that worries someone, it's the manner that they will die. And I think having knowledge does provide peace and comfort. So the things that people really worry about is their symptoms, their pain, their dignity, and I would gently explain to someone about symptom control and what might happen.
You mentioned fear about how people die. Can you elaborate and provide an example of how you would explain the dying process to someone?
A gentle explanation of what happens is so important when someone's dying. I tend to use stories and examples, and I describe the dying process a little bit like someone's battery is running out. Unfortunately, people have so much fear because all they see is what's on the television or what's on the movie. But by and large, over the last 20 years, the people that I see dying, they're slowly running out of battery power. Their breathing starts to change. They spend more time sleeping, less time awake, less time interested in what's happening. Their hunger is no longer an issue. As their thinking slows down, their temperature cools down, the breathing becomes slower. At some point, they will just take that last breath and die peacefully, hopefully with their loved ones around them.
Thank you, Peter. Dying is a central element of the human condition, so thank you for demystifying the dying process for us.
It's a pleasure. What Kathryn and I are trying to achieve under the Statewide Palliative Care Network is to provide the best possible palliative care experience for patients and families who are experiencing a life-limiting illness. And we're doing that all under the auspices of the CEIH.